Hello, my name is Dr. Jeff Angobaldo, a board-certified plastic surgeon serving the Dallas-Fort Worth area, otherwise known as Dr. Plano on social media. Today's topic is fat transfers of the buttocks. It's also known as the Brazilian butt lift. It's been very popular over the last 10 to 12 years from people who are actors or social media, and so it's grown in popularity over the last 10 to 12 years. I would say for this area that we do one of the largest number of cases in the area. And so we want to talk about some of the safeties, some of the risks, and some of the outcomes with fat transfers of the buttocks. A good patient for fat transfer should be someone that kind of takes care of themselves. Someone that's, exercises, eats well, is not too heavy. In addition, someone that's also very realistic, because having realistic expectations is crucial for any surgery, especially liposuction and fat transfers. For example, if someone's very deflated and has little volume, don't expect to have a huge, large, round bottom. Just having a small difference would be enough, especially someone who's also very thin. So having realistic expectations are key for a successful surgery and for successful outcomes. When the surgeries were becoming very popular, there was a large number of deaths across the country. At one time, it was 1 out of every 3,500 cases. And about 30% of those cases was in one clinic in Miami. But either way, so a lot of surgeons stopped performing the fat transfers. So really, not only do you have to go to someone that's a board-certified plastic surgeon for your surgeries, but you also should go to someone that's experienced for safety reasons, especially with this particular surgery. One of the things that I've learned over the last 10 years or so, I kind of modified and changed my techniques over the last 8 years. My main focus has been just on volume before, as is everyone else. But when I injected volume, it didn't really change the shape as much as I wanted, especially around the central buttock area. So what I started doing is looking at different angles, side view, oblique views with the before photographs, and kind of tailoring every patient for a nice change in shape. So what I've done over the last 8 years is change my techniques around to make it more for shape and also volume. But the biggest goal is for a change in shape, because afterwards, you can't beat that type of result when someone has a perfectly circular round bottom. A good example I'm going to highlight is this before and after photograph of a patient that surgery was performed maybe 5 years ago. And if you can see, she's got a pretty good volume on top. She's got good volume at the base of her bottom, but the entire central region is pretty flat. So if I just inject the same amount of volume per butt cheek without taking any consideration, it'll make everything larger, but you won't really change the shape as much. So my goal is always to have a nice C shape. So creating a C shape, we're actually injecting fat in certain areas of the bottom to give him that C shape. So for this particular patient, where essentially 80% of her bottom is flat centrally, we're going to put a lot more volume in that area. As you can see from the after picture, she has a nice C-shaped bottom. And that's always our goal now with all of our patients. Now, some folks can be more deficient superiorly. Some can be more deficient inferiorly. And in this particular case, she was deficient in volume in the middle central portion of her bottom. So basically, every patient gets a tailored treatment to create that C-shaped volume, which is our goal. So if someone is more deficient at the base, we'll inject a lot more in that area. So that's how I kind of evolved my techniques over the last couple of years for just better results. In the next photograph, what you're looking at is a post-op result that's 3 months after her surgery. As you can see, the hips and the lower back and the flanks contribute to a boxy-shaped bottom. So that's really essential to liposuction the lower back and the hips. Where do we inject fat is between the hips and outer thigh. This area right here. That's where we inject our fats. So if you look at her post-op picture, the goal is always to create a really nice hourglass shape, and that's what she has afterwards. So these are different aspects in the evolution of how we've changed, or I've changed with my techniques and how I perform my fat transfer procedure. So, liposuction in the back is a very powerful tool to really shape the torso of someone. You can make someone have a really nice hourglass shape just performing liposuction of the back and the hips. Adding fat transfer to the outer buttock really makes a nice difference, really solidifying that nice hourglass shape. In the side view, you can see her before and after at 3 months. So at 3 months with liposuction, you're still healing. You still have some areas that are swollen. The fat in the buttocks don't really change after a couple of weeks, but final results for liposuction takes about 6 months. As you can see, she's changed a lot. She's kind of flat a little bit centrally, so now she's got a really nice C-shaped bottom, and she has a much smaller waist from the liposuction procedure. It's a really nice result at 3 months. This next patient, very similar. You can see how the power of just liposuctioning someone's back, how it changes the entire shape of the torso into a nice hourglass shape. The fat just adds more refinements to that. You can see where we're injecting the fat right in that area between the hips and the outer thighs, creating a really nice curve. And so when we're looking at our before pictures, before we create our surgical plan, you're looking for areas that need more volume than others. And for some folks, as mentioned earlier, it could be in the top part, could be centrally, could be at the bottom part. And everyone should get a little fat transfer to the outer buttock to give them that nice hourglass silhouette. Our next patient we'll be discussing is 6 months out from her liposuction of her abdomen and back and her fat transfer. What makes someone a good candidate for the liposuction? They have good skin tone, they have realistic expectations, as we already discussed about that. A stable weight, because with any cosmetic surgery, you really don't want to gain more than 10 pounds with any surgery that's performed, especially with liposuction. Obviously, people that don't smoke, that is a huge risk factor for complications. As part of our protocol before surgery, all of our patients get screened for a urine nicotine test and a urine pregnancy test. And make sure they have good motivations and expectations are crucial. So, this patient is a mom. She's got a little bit of loose skin, but overall pretty good skin tone and minimal elasticity. 6 months later, you can see she's got very good, she almost has like a very athletic look with her abdomen, because one of the techniques I've refined over the last 10 years is just doing a little bit of etching, creating definition. And she's got pretty good skin tone and definition. And looking at her back picture, you can see she's got a nice hourglass shape. And as we mentioned earlier, it's the hips and lower back that makes a buttock look boxy. And so what's key is to liposuction the hips and lower back, and to put fats into the area in between the hips and outer thighs, creating a really nice hourglass shape. The combination of the liposuction of the back, hips, and the fat transfer to the outer buttocks creates a beautiful hourglass shape. It really complements, both procedures really complement each other for better results. Incisions for the back, there's one right above the crease. We also use that to inject fats. And we also use 2 on each side of the upper buttock and 1 in the bra area. These scars are very well hidden. And you can see when we're analyzing her buttock from the side view, she's deficient superiorly. So unlike that first patient who was deficient centrally, this particular patient has volume, and she's got a very low, heavier bottom, and there's not much on top. So we really wanted to build up the superior aspect of her bottom. You can see in her post-op picture the liposuction of her front and back. She looks really good, and she has a much smaller waist because of that. So that's what our final results are at 6 months. And you can see with her bottom, we built it up. She has a nice C shape, and she's built up on top. She's got a lot more volume superiorly. So this is a really nice result just showcasing our refinements and our techniques, really emphasizing shape. One of my favorite views with any fat transfer procedure is the oblique view, because you can realize how much we've liposuctioned, and the bellies are very flat and they have very good tone and definition. But when you're looking at the side, you're going to see a lot of lumps, hills, and valleys. And afterwards, you're seeing a very smooth hourglass shape. And that's from the liposuction of the torso, abdomen, back, flanks, hips, and fat transfer to the outer buttock. It's remarkable how you can change so much shape with just procedure. There's a very high patient satisfaction. Our next patient had a lot of volume already, and I was wondering, why would you want to come in for a consult for a fat transfer? And she says she wanted more of a rounder, shapelier bottom, especially on the sides. And as you can see on her side, she's a little bit flatter on the side. So all I injected after her liposuction was fat in the outer buttock to give her more of a nice, really emphasizing her hourglass shape. The liposuction looks good, she's got good definition. And you can see she's got a nice hourglass shape on the side. When you're choosing your surgeon for these surgeries, you gotta make sure they're experienced. They're board certified plastic surgeons, and you gotta look at a lot of before and afters. We try to match patients' height, weights, and body habitus with a before and after photograph. So we have a lot of different PowerPoints on patients with higher BMIs, patients who are normal, and people who are very thin, to see a different range of outcomes, just to give people realistic expectations. And that's where the consultation comes in. For her, as you noticed, she's a little deficient on the outside. She wanted more of a shape, and that's where we're injecting fat in this whole area where I marked. And that is where we're injecting the fat in the outer and the outer central buttock to give her a nice hourglass shape. Post-operative care involves really listening to your surgeon and following all their instructions. Don't go on Google, don't ask your friends, just adhere to your surgeon's instructions. That's what's key for successful results. We always recommend our patients before surgery and afterwards eat a high-protein diet and also take their vitamins. The first week is crucial with any fat transfer because you want that fat to survive. We're taking it from an area that has a blood supply and putting it into the buttocks. And it takes about 3 to 5 days to start forming small arteries and veins, these little connections, to allow it to survive and get nutrients. So the first couple of days, it's surviving with just diffusion of nutrients. So it's really key. We tell all of our patients, other than walking every 2 hours, just a little bit around the house, you want to really not be too active. Don't do much activities in the first week. We also tell our patients to offload any pressure. We give them a pillow to sit on. It's called a BBL pillow. And with that, you're able to sit the next day, all day. We also tell our patients to sleep on their stomach for about 6 weeks to 2 months. So there's a lot of instruction that we give a lot of our patients for successful results. But let's say if you're sitting down the next day or a week later, potentially some of that fat can die, and that's a complication. And it's, some of the fat could atrophy, and if some fat dies, it can lead to hard areas. It's called fat necrosis. And it's just, no one really wants to have complications. So just adhere to our recommendations and follow all those instructions. We also treat a different subgroup of patients, the really thin patients. Buttock implants, have a 30% complication risk. So how do we avoid that? We try doing a fat transfer procedure. And we're usually, when we see a thin patient, we're liposuctioning a lot of different areas to get enough fat, the abdomen, the back, the arms, even some of the inner thighs. Our next patient is a very thin patient. And as you can see, we're lipoing everywhere, her back, her front, her hips, her arms. And if you can see it, that she's deficient in her outer buttock, And once you see the side view, you'll appreciate that she's also a little deficient above. So above the central superior aspect of the buttock. Afterwards, at 6 months, she has nice hourglass shape. It's very smooth. The fat all took. You know, we have a different technique in how we inject fats. We centrifuge all of our fat. The process takes an additional half hour of time, but it's definitely well worth it. We also use like injection cannulas that are blunts to decrease the risk of any complications. And you know, a lot of our fat takes. We're not just injecting and blowing up an area, because a lot of that fat will atrophy. I would say with our techniques, we have about a 75% survival rate after a couple of months. So we have very good results, and it's just the way we process the fat and how we inject it. It's a little bit different from a lot of people. There are all risks, you know, with this surgery. You know, the biggest risks, you know, I would say is just from liposuction, seromas. You can also get some asymmetries. Particularly with fats, you know, asymmetries definitely can occur. Infections, scarring, dead fat, or fat necrosis can occur. But one of the scariest risks is fat embolisms. And that's when you're injecting fat into the vein. So, and that can go right into the lungs, and that's almost immediate death. So it's a very scary complication to have. It's very rare, but it can happen. So how do we prevent that? We don't inject. We inject very superficially, number one, and we try to avoid those areas, and definitely not injecting very deep in those areas. It's always in the superficial plane throughout the entire bottom. As you can see, she's got great volume afterwards. You know, before she was kind of deficient almost everywhere, and we put a little bit more in the outer buttock and the outer superior aspect of her bottom. She's got a perfect, nice C-shaped bottom. And you know, the liposuction of the back creates a really nice hourglass shape complementing her bottom. So it's a really nice result after her fat transfer. Similarly, another thin patient, you know, she's got the hips and the lower back that makes him look a little boxy. Lipoing this really changes the shape of someone. She has got a nice hourglass shape afterwards. The fat transfer in her outer buttock looked great. It's a very nice result in this particularly thin patient. You know, instructions are also key. You know, people ask if lymphatic massages help. They do. You know, it helps with any fat necrosis after lipo. It helps with the edema and the swelling, and preventing fibrosis. So I always advocate to our patients, it's always good to get lymphatic massage early as possible, you know, in the next day after liposuction, if you can tolerate the discomfort, because liposuction feels a little bit like bruising and it hurts. And so you want to avoid, you know, any type of too much pressure in those areas, because it does hurt. So people ask about post-op care and recovery. You know, so we have our patients wear fajas, which is a compression garment. In the first couple of weeks, we switch them out after 3 to 5 weeks to a secondary garment. And these are all made for fat transfers to the buttocks, meaning that there's not much compression in the bottom area. All the compression's coming in the abdomen and back area. After the secondary garment, there's also a tertiary garment that usually starts around 6 weeks. You don't have to wear anything after 6 weeks. The thing is that it makes you look better, because people do swell, because final results for liposuction is 6 months. And some folks, even 3 months later, if they don't wear compression, they'll swell and they'll have some painful areas reoccur in 1 or 2 small areas around their body. So having compression really helps with post-op pain and swelling. And lymphatic massage also helps. It helps with the swelling that occurs after liposuction, helps with prevent fibrosis, and also can help with some fat necrosis to smooth out those areas. Very beneficial to start an active lymphatic massage program even the day after surgery. We also use fat when we're looking at the shape of a bottom. There's this one area that's being shown here. It's called a medial buttock cleft, and some folks call it the chicken butt. So what we do with this area, we inject fat to smooth out this particular area. Afterwards, it's a nice smooth contour. It's never perfect, 100%, but every surgery is always going to have an improvement in the shape. Our next patient has a more severe chicken butt, you could say. It theoretically looks like at the lowest inferior aspect at the bottom, like just some area of fullness. And so it creates, it's not a very smooth contour for someone. So if you notice that with our patients, we always treat that particular area to smooth out the buttock, the lower buttock region. So it ends up being a very nice, smooth result. So we also listen to our patients. A lot of patients want more in the outer buttock for more of a rounder shape on the outside. Some want a little bit more at the bottom to give them more of that heart shape. And some want correction of their chicken butt. So, listen to patients and giving them good realistic expectations, we can really target the best surgical plan for them. So, the key is just good realistic expectations and selecting patients who understand and are realistic of the results and what they can achieve or what we're working with. So this concludes our podcast on fat transfers to the buttocks. We hope you enjoyed it and learned. If you're interested in a consultation, you can always call us. This is Dr. Plano. We're based over in Plano, Texas, serving the Dallas-Fort Worth area.